Okay, we are live.
Good morning, everyone, and welcome to the Community Connect Live with Support Fibromyalgia and Looms for Lupus. I am Estela Mata, one of the co-founders of Looms for Lupus, and joining us is Melissa and Juana. Sister,
Good
do you want
morning,
to?
everyone. I am Juana from Looms for Lupus, and we're happy to be here today sharing.
Hi, everyone. Good morning and good afternoon if you are in the East Coast. I'm Melissa Tolwer. I am the Executive Director of the Support Fibromyalgia Network. I'm also a board certified health coach. And for fibromyalgia, we focus on patient and medical education, advocacy, and research. So we're excited to be here this Friday. We have a slide presentation we can add in.
Yes, we're a bit more prepared this time. Last week was our first show, so we're kicking it off now with a little bit more of a process. So it'll be better for you to follow along.
Yeah, we welcome everyone. These are updates from our communities. So lupus and fibromyalgia, chronic illness. So last week we shared quite a bit of information. So we're going to continue to update you. We just wanted to take a moment to recognize and honor September 11th as the National Day of Service and Remembrance of 9/11 Day. We wanted to let everyone out there know, and I've seen posts from our chronic illness community, that your loved ones are not forgotten. There are many events taking place online, which is a unique opportunity to share. I've seen some of them posted, so they'll be streaming live. So please take that time to participate in the community.
Yes, definitely. I still remember, when 9/11 happened, what exactly I was doing. So it's something that, we will never forget. So, we remember everyone.
Yeah, and we definitely want to take a time to honor our first responders. I know with all the fires taking place over here, I am extremely grateful and for the first responders and the people that responded to the event. We appreciate all of your work that you're doing. So I'm going to look forward to some of the online streams. I know they have some light tributes and things like that from Washington, D.C. So I'm definitely going to be looking forward to all of that. Let's get started with the updates. So we have some good updates coming from, and we'll let Looms for Lupus start it out. They have a lot of events going on this weekend. I don't know how they're going to do it. Going to be everywhere, jumping around, but these are great events that you can participate in. So I will let them take the lead on this.
Okay.
Okay, so
okay,
go ahead, sister.
Okay, well, as everyone knows, we do have support groups every second Saturday of the month in Baldwin Park, California. But because of the pandemic, we are having the support group virtual and via Zoom. It is private, so everyone that wants to join our support virtual or their Zoom support group has to register or has to let us know, send us an email, a message via Facebook or any social media, and we will provide you with the information as to how to log in to the support group that's virtual. But we do also have a support group in Spanish via Facebook Live, again, every second Saturday of the month at 8 a.m. And that's Spanish. You do not need to register for that one. It is a Spanish support group, and it is via Facebook. Go ahead, sister, now with the other information.
I didn't add the times. Do you want to mention the times for your virtual support group?
Yes, the virtual support group is at 9:30 a.m. to 11:30. So again, you're welcome to participate, but you do need to have a login information, and you can email us, send us a message, and we will provide that information to you. The Spanish via Facebook support group in Spanish is at 8 a.m. every second Saturday of the month.
Yes, and it's this Saturday. So this Saturday is the second Saturday. So we will see you all. Los esperamos a las 8 de la mañana en Facebook, en vivo. and we will wait for you. And we are excited to meet with everyone on Saturday also for the Zoom support group. So if you want to email us, you can email us and we will send you the information for the Zoom information, which is at info@loomsforlupus.org, or you can also email or go to the Lupus LA website because they also have the information on there. So the other thing that we have going on this Saturday, so pretty busy Saturday, we have the Lupus Research Alliance virtual walk. That's this Saturday starting at 9 a.m. Pacific time, and I believe it's like 12 p.m. Eastern time. So that's going to be virtual. So if you have not registered for the walk yet, if you guys want to join our team, we are under Team Looms for Lupus, and we'll put in the link. And the virtual walk, obviously it's free, but we do encourage you to donate, even if it's a small donation, $1, $2, $5. And the reason why this is so important to us, and you would think, why are you fundraising for another organization and not your organization? Well, the reason we do it is because Lupus Research Alliance does a lot of research. That's what they do. They do research. So 100% of every dollar, that means like the whole dollar goes straight to research. So that is why we do it. Not only because of that, but it's also tax deductible. So you guys can claim that on your taxes at the end of the year. But again, this is the only organization that 100% of the donations go to lupus research. And we all know without research, we don't have better treatments or a possible cure. The other event that we have is the Lupus LA virtual dinner party, and that's also this Saturday, and I believe that's at 6 p.m. For information in regards to that dinner party, you can go to lupusla.com, and when you that is not free. That is not a free event because they do have entertainment, and I believe it's $50 per person or $100 for two. But if you want to join, you could get information on there.
You get I saw Top Chef was going to be there. Top Chef and Lisa Loeb was going to be there.
Yes, that's why yes. I love Lisa Loeb, so the Top Chef.
And I've eaten at that Top Chef's restaurant. I'm blanking on her name right now, but I've met her, so that's why I saw her face in the picture. I was like, "Ooh!" I was like, "This is fun."
You're like, yes, and and one of the reasons that we also, you would say again, why do we promote this? Well, the reason we do this is we collaborate with both of these organizations, but one of the main reasons why we like to highlight the Lupus LA events is because Lupus LA does so much for the community. They have patient grants for patients that have lupus. They have the support groups. They do so much for the community. So anything that goes into Lupus LA goes back to the community. So that's huge. Also, this Sunday, we have the Lupus Chat on September 13th, and that's going to be at 3 p.m. Eastern Time, 12 p.m. Pacific Time. And what that is, for those of you that have Twitter, it's basically a Twitter chat, where we're going to be talking about fibromyalgia and as a main condition and also as an overlapping condition. So we all know that a lot of people that live with lupus also have a 20% chance of having fibromyalgia. And as we know, we live with fibromyalgia, the three of us. So we are going to be on there on Twitter. So if you want to join us this Sunday at 3 p.m. Eastern Time, 12 p.m. Pacific Time. I do want to highlight one thing that I just remembered really quick. For the Lupus Research Alliance virtual walk, donations are going to go all the way to December 31st. So if you don't have time this Saturday to raise money, you can raise money all the way to 12/31. The other thing that I do want to encourage you to participate, and the reason I want you to do that is there are a lot of prizes. So everything's going to be virtual from home, and they're going to be giving away, if you know who Lady Gaga is, who also lives with fibromyalgia. Lady Gaga has donated some backpacks, so they're going to do giveaways. So they're going to have Lady Gaga backpacks. So that's pretty amazing. So didn't want to forget that detail.
No, you can't forget that detail. Just to let everyone know, we'll have the links and descriptions to all of this in the video. So what we do is we stream it and then we add the updates into the video after. So stay posted for that. So we'll have all the links so you can participate in that information. We didn't add this to the updates, but there's a new fibromyalgia cookbook that I was able to get. So hopefully we'll have the author on soon, but I wanted to give that a shout out as I just got it in the mail the other day. Oops. And I don't know what it got a little bit squished everywhere, but we just wanted to give a shout out that it's the 30-minute fibromyalgia cookbook. I was able to talk to the author, so hopefully we'll have her as a guest on shortly.
That's amazing. That's amazing because there's always, we always want to know what can we do. Is there a special diet? Is there something that we can cook fast? If it's like a 30-minute, cookbook, to cook meals, that's even better. But that's amazing. I'm looking forward to hearing more about that cookbook.
Yeah, and just a shout out to everyone joining us this morning. I see Rick, Brandy, Wanda. I know Crystal, I saw from the Fibromyalgia Pain Chronicles, Joe. So welcome to everyone joining us this morning. We're excited to be here with you. Was there any other updates that you had? I know we tried to make this comprehensive list, but please participate in these events.
Yes.
Okay, next forward, we have an update. So last week we had talked about all the work that was getting done with mental health services and legislation. So there's been an update, which I saw that you guys retweeted from your representative. Did you want to get into, you have updates for us with that?
Yes, let me see. I can't see the notes from over here, but
oh, okay.
I could probably bring it up. If you can read them, you can read the notes, but I'll give like just a quick little update of what I know and how this is going to change and or impact our community. So here in San Gabriel, in the local high schools, junior high schools, and even elementary schools, Congresswoman Napolitano has implemented this amazing program where they provide mental health services to children, teenagers. And, there's so many people that need this at an early age. So when we start talking about mental health, and we start talking to our teens and we start letting them know that we are here for them at the schools and that they're able to reach out, I think it's pretty amazing. So we have had that happen here in San Gabriel Valley. And I believe this is another one of the bills that she authored and that I believe passed the Commerce Committee during this last, I think it was like 2 days ago on the 9th. So that's pretty amazing. But if you can read the details in regards to the bill, that would be great so other people know what the bill is going to bring and how it would help us.
Perfect. Yeah, this bill, so it's the HR 1109, unanimously passed the House Energy and Commerce Committee during a full committee markup. The bill creates a total of $130 million in grant funding for schools across the country to partner with local mental health professionals to establish comprehensive mental health services for students. This proposal educates the entire school community, from students and their families to teachers, administrators, and support personnel on the warning signs and symptoms of mental illness to help identify and treat mental health issues before they escalate.
Exactly. And this program is pretty amazing. And I just want to give a shout out to the Kaiser Permanente Educational Outreach Program, where we host our support groups, without when the pandemic's not around, hopefully we'll go back and reconvene. But the in-person support groups are where we host them is there at the Kaiser Permanente Educational Outreach Program. And Ruth Padilla King, who is a licensed clinical therapist, also works closely with these programs at the schools. So, it's a huge help again for teenagers and for those students that need the assistance. So shout out to Ruth and to that organization for also working with the mental health resources there at the high schools and junior high schools.
So Rick just posted the link to the bill, so thank you for posting that. Rick, we'll definitely have to pin that somehow. Oh, before I forget, and before we move forward, I wanted to ask Juana about the All of Us research presentation she did. you want to share a little bit about more? I know we kind of brought it up last week, but we'd love to hear from you how it went.
Yeah, so if you
Well,
want to just share, sister, what your participation, what you would be discussing during these All of Us research programs, webinars.
Well, on this last participation or webinar that I did with All of Us Research, we I talked pretty much about my experience with All of Us Research, how I learned about All of Us Research, and like I mentioned to them, how I learned about it is I was an advisor for patients like me. I learned about it and I thought it was very good, very interesting. Called right away and I became a participant with All of Us Research. That's how I learned about it. Then later I became an ambassador, a virtual ambassador, an advisor for USC, All of Us Research. And now I am an ambassador, a national ambassador. So it's just sharing my experience and why I am participating and why I think it's important to be part of All of Us Research.
Oh, that's fantastic. Thank you. I know if people have questions, you can reach out to Estella and Juana about All of Us research. We posted the links in our last video and we'll make sure to do it this time. So I just love hearing from you guys and sharing your stories. So, and then speaking of sharing for everyone out there, we've been participating in some awareness months and this is no way comprehensive, but I just listed some of the ones that we've been participating in throughout. You'll see us share information. So we have Pain Awareness Month, Suicide Prevention Awareness Month, Polycystic Ovarian Syndrome Month, World Alzheimer's Month, and I had to throw in National Yoga Awareness Month because of its relationship to the things we do. I just missed that. So maybe we can share some information on yoga. But do you have any updates regarding some of these awareness months? I know you created your own graphic yesterday that we were sharing as well.
Yes. So the whole month is Suicide Prevention Awareness Month, but yesterday was National Suicide Prevention Awareness Day.
Mm-hmm.
And, that's something that not a lot of us talk about. And, the reason we bring this up is because a lot of people that live with chronic conditions, we have a lot of veterans, that lose their lives every day. I mean, every 40 seconds, one life is lost because of suicide. And I think it's so important for us to not only raise awareness, but also provide the support and the information for those people that are struggling. Because, as we all know, and I always think of this, I always think of, oh my gosh, I forgot his name, Patch Adams. I forgot his name. What's his name? The actor, that movie, Patch Adams. I can't.
You just came.
I know, right? There's my fibro fog. I have slept only like 3 hours. But I will think of it in between the time. But one of the things that Robin Williams, there you go. I always think about him because he was amazing. He was always laughing. He was always joyful. He was always, thinking of creative ways of how to help and how to bring, laughter for kids in that movie and just everywhere else. He was a comedian. So to think that someone looking so happy can be struggling so deeply and emotionally and not be able to either get help or for us to not be able to help is huge. So if I could just put that number out there for someone that may be struggling, that's why we do it. So yes, it is Suicide Prevention Awareness Month. And then, last week we talked about how my sister Juana and I, through Diddy Hirsch, we were able to attend a training on suicide and suicide ideation. And, it's something that we shouldn't be ashamed about. Sometimes we do think, what, we have these ideas and it's okay because it's okay to feel angry. It's okay to feel these feelings. It's okay. We just have to know where to go for help and how to help each other. So,
Right.
I know I went too much into that, but that's really, really like one of the biggest things that we like to talk about, which is why we're in the mental health caucus, with you, Melissa, because so many of us suffer from mental health. Mental health runs in the family. When you add up chronic illness, and then you add up all these natural disasters and COVID and fires, it's a lot.
And unfortunately, a lot of the times the family members, loved ones don't see the signs, and or the person is not talking about it because either they're embarrassed, ashamed of sharing how they feel or what they're feeling. An example, it just happened this past weekend or this week. Mexican celebrity died of suicide, and one of the things that I heard a few times is that his loved ones, family members, and very close friends did not see any signs of him being depressed. And from one day to another, I mean, they find out that he's no longer living because of dying of suicide. So that just goes and says so much about, how a lot of people don't show or are not sharing what they're feeling, and they're going through a lot of pain, emotional pain, without showing the signs.
Yes. And, one way to kind of, talk about it. And I just saw actually one of our friends posted something, because I know it's hard to talk about or to say the right words to someone. How do you do that? Like, you don't just ask them, hey, are you feeling suicidal today? I mean, some people don't know how to ask or how to connect with others. So I saw a post that our friend Yureli posted, and she said, these are some tips and ideas on how to talk to someone or how to reach out to someone, or what you can say to someone. And you tell them you miss them. You share something that made you think of them. You remind them that they are not alone, and that's what we want to do. You let them know that you're free for a chat. Make yourself available. Remind them that they are loved, and also ask them about maybe something that you saw on their post on their Facebook or on their Instagram, and acknowledge that things have not been easy. And again, acknowledging our feelings is huge, because you are allowing yourself to feel and say, it's okay to feel this way. It's okay. And, we'll get a little bit more into, when dealing and coping with natural disasters in a little bit. But, I just wanted to highlight that. But yes, and World Alzheimer's Month, and I know, Melissa, you like to read a lot. And there's a lot of connection between the brain and even Alzheimer's and like fibromyalgia. So, World Alzheimer's Month is huge for us to bring awareness of. We don't know, if anybody is going to, it doesn't run in my family, but we don't know if any loved one or anyone that we know would be living with these illnesses. So it's really, really good to know and be aware of all these conditions, because that's what the awareness is all about. It's about connecting and knowing what somebody else is going through and feeling that empathy towards each other. So National Yoga Awareness Month. Yoga, I know, helps with a lot of stretching for a lot of the conditions that we have, the lupus, the fibromyalgia. So that, I'm hoping we had a yoga session during our lupus support group. And it's one of Juana's friends, and she actually is a social worker, and she's also a yoga instructor. So we're hoping that we can have her at least talk to us and teach us a couple of yoga stretches, or maybe chair stretches that we can do. So shout out to all those yoga instructors. I'm not a huge yoga fan. I cramp a lot, but I will definitely try it again.
Oh yeah, I mean, we do our best when it comes to that, and there's so many versions. I know you had talked to someone as well about chair yoga, so there's different ways to do yoga than what we think, and I'm really intrigued by chair yoga, so maybe we share more resources by that, because getting me off the floor is going to be a little bit difficult. So
yes, and I just remembered, Dr. Blyde, she is also she has a free yoga video, so we will put the link on here. It's free. You can go to her website, and she has the whole instruction on chair yoga. So shout out to Dr. Blyde.
Perfect. And we definitely included PCOS because many of us who are diagnosed with fibromyalgia and lupus also have PCOS, and women's health is so important to all of us, and have Pain Awareness Month connected to all of these as well. So we're going to continue to share content out there, and definitely have more content on mental health. I appreciate these conversations. It's hard to definitely open up and talk about our own experiences. So I always appreciate people sharing. And then I think we have our other slide. This has been a hot topic for us in California, Oregon, and Washington. And I know a lot of you out there too on the East Coast and South with the hurricanes, and just how to manage your health during a national disaster. And this is the part where we just ask you to chime in if you have any tips for us to have an open discussion. I know, Estella, you put some things in the speaker notes as well. Do you want me to just go over that, or you want to share a couple of the thoughts that you initially put in there?
Yeah. So, I mean, a couple of the things, when we're talking about natural disasters, obviously, today we're honoring everyone and all those lost lives for 9/11. That was a huge, it wasn't a natural disaster, but, it still impacted the whole United States and the whole world. So, those are the things that affect us. So these fires are affecting all of us. So I know they're a little bit closer to some of us than to others. However, we are all in this together. So, just be very cautious. I know I put a couple of tips down there, Melissa. So if you want to just kind of highlight about, I know we're talking about fires, and we're also talking about COVID. And so there's different things that we have been dealing with, but I know all of them, whether it was remembering 9/11 and the lives we lost, and, COVID, and those that we have lost because of, COVID, and those that are sick with COVID, and just us continuing to take precautions, has taken a toll on us. And, not being able to connect with one another, not being able to show our feelings really, or talk about them, is huge. So there's a couple of tips that I gave on just, for like COVID and then fire, what's going on with the fire. So yeah, you can read them, Melissa.
Okay, so I mean, the fires, everybody knows that have been affecting me. We've been in evacuation warning since it first started, since I'm near the Bobcat fire. So it's been, I mean, right now I'm trying not to cough or sneeze, so I apologize. It's really smoky in the house. So we've been walking around with masks, and we have our stuff packed. I think that was the realization. So here you provided, Stella wrote, stay safe, close doors, windows, stay indoors, keep track of fires, prepare for evacuation, reduce smoke exposure. So Estella, I'm doing all of those things. My family.
Of course you are.
But
I
have to admit, this was more difficult. Like, even though I had my family plan all this stuff, like, what are we going to pack? Have a bag ready to go. Like, we have our stuff sitting right near the door. Some of the stuff is still in our car, but all the ash, like, there is just ash covering our garden and all the things right now. And like I mentioned, it's smoky. We've been wearing our masks indoors because it's so bad. So, and the vigilance for all the people out there, like sleeping with one eye open. We were sleeping with our clothes on and having everything ready in case, but I can admit that it hasn't helped my fibro body because we haven't been getting much sleep. So I think that's why we brought this up, is just how do we manage our health with even trying to get good sleep? I don't know if anyone has tips for sleep during these points. It'd be good, but I'm trying to do my best with taking some extra supplements and still trying to eat right and get nutrients and do meditation. And I know for COVID, Stella and Juana, you mentioned connect with others, manage some of the stress by keeping the daily routines, exercise, meditate, mindfulness, breathing techniques, and get plenty of sleep. So I have not been good with that.
I don't think any of us have been getting a lot of sleep, but one of the things that, my sister Juana and I were just talking about, and maybe she could give us a little update on this webinar she attended, is I like to try and focus on the good, right? So we are going through so much, even though I didn't have a lot of sleep last night, even though it is affecting me right now, the allergies because of the ashes and the bad, just the bad weather, and just everything really going that I've been going through has been affecting me every day. But the one thing that keeps me going is trying to keep a routine, and also trying to maintain positive, and trying to focus on the good, because there is some good in everything and in every day. So as far as the routine, you can see I still have my makeup on, even though my eyes are watery and my makeup may be runny. I try to put my waterproof eyeliner, but that's part of my routine. It makes me feel good to get up in the morning, put my makeup on, do my hair. Doesn't mean I feel 100% when I get up, but I try and focus on something positive. But yeah, it's been a little difficult. But if you want to just say
Right.
really quick, sister, something.
Like
um,
Estella said, it is very difficult, but having that routine really helps. I attended a seminar yesterday, or a webinar, sorry, a webinar that was about positivity. Positivity, the doctor talked about, how being positive actually helps with our immune system, that we tend to do better, and being realistic, optimistic, it does definitely help our bodies. And one of the things that I really like that the doctor said, and that's something that my sister and I always talk about, that we might think of, okay, I'm at home, and because of the pandemic, I've been here, I haven't been exercising, I've gained a few pounds, but hey, it's okay. My eyelashes, my makeup, I still look cute. So, I mean, that's being positive. And yeah, things might not be the way you want them to be, and things might not be what you expect them to be, but just having that positive attitude helps. And that's one thing that my sister and I have always talked about, that do what you like, do what makes you happy, and just always be realistic, and try to focus on the good things. Yes, we might be going through a lot of pain, we might be going through a lot of situations right now with the pandemic, the natural disasters, but we have to think that we're with our family, that we're alive, that we are breathing, that we're okay, and just keeping a positive attitude. Another thing that that my sister and I always talk about, having those positive affirmations when we wake up or when we go to bed, that helps. And so I encourage everyone that that yes, we're going through a lot of difficult times, but just focus on one positive thing. And there's many negative things that are going on right now, but let's just focus on one positive thing, and that should help you.
That's great information. And I'm going to take even your advice for myself and really focus on at least finding some joy right now, even in the midst of all of this. Like, what can I find that's positive? What can I have some gratitude towards? And really focusing on some aspect of joy. So I think I'm going to take all of your advice right now, even for our own family, and see how we can do it. So we appreciate that.
Right. Another thing that the doctor did mention is that there has been studies to show that with having a positive attitude also has shown that, or studies have shown that people's pain, or the pain that we're going through, is lower or reduced.
Definitely. And
I
Wanda just
believe, I
Wanda
believe,
just put, Sister Wanda just
yes,
put a note, Wanda Green, she said, gratitude being
yes,
upbeat, prayer, and mindfulness.
yes, definitely, yes.
Well, we appreciate everyone joining with us. Do you have any closing remarks, Juana or Estella, before we close out?
No, we're praying for everyone out there that is being impacted by, these natural disasters, the fires, and just for everyone that has been dealing with any sort of depression, or anything that they're going on in their lives right now. Know that you are not alone. Know that we are here for you. Know that there is help out there, and that obviously you matter to us. And, talking about finding joy in something, this is one of the things that I find joy in, connecting with my sister, connecting with you, Melissa, connecting with Wanda, with Crystal, with everyone that tunes in and everyone that will watch this, because I do this for you. I do this because I know that I can try and help, and this is doing my part, and that's what makes me happy. So this is a joyful thing for me.
Yeah, and just to let Christine, and I saw our comment. So Christine, we love you. Please take care of yourself, and just everyone out there that we're here for you. I know all this. Please reach out, please share, and we'll get back to you as soon as we can.
Yes.
And I put have a relaxing weekend, but is there other word choices that we can share with other people to have a joyful weekend? Maybe we add that in there too.
Definitely, yes.
Yes.
That's great.
Yes. A joyful weekend.
Well, thank you to Juana and Estella for joining us here. We will definitely, I know you guys will have updates, so please stay posted to their Facebook page, their Twitter account, Instagram, because they will be tweeting and retweeting all from the virtual walks and all the virtual experiences, Lupus Chat. And we will be back for an update of stuff. We have a lot of conferences, I think, coming up. So we'll be back in action next Friday. And stay posted. Thank you, everyone.
Thank you.
Thank you.